engaging the community since 1970. This is WIS Awareness.
Good morning and thanks for joining us on Awareness Today. I'm your host, Leland Pender. Right now, enrollment in the Affordable Care Act is open. It runs November 1st to December 15th. Have you signed up? If not, there are some folks here today that want to help you do so, or at least help you learn how you can learn more about the Affordable Care Act. I'm joined now by Dr. Macy Smith, a social worker and gerontologist, and this is J.T. McLaughlin, the president of the Columbia Urban League. And you both are here today because the Urban League, once again, has received some grant funding to help educate the community and bring awareness to the enrollment process for the ACA.
Yes, thankfully, we're in our second year of receiving funding from Community Catalyst by way of National Urban League, and that is to provide outreach and education to try and mitigate some of the negative connotation and disparities as it relates to cutting of that funding, to be able to educate individuals about the ACA Affordable Care Act, how to sign up and what to expect this year.
And there are some changes and new things to be aware of with this enrollment period.
Yeah, one of the things to be aware of is that we don't have the penalty anymore in terms of not having health insurance. Also, too, in the state of South Carolina and the Low Country in the Charleston area, there is another insurance carrier, not simply Blue Cross Blue Shield, but also All Better through Absolute Total Care is an insurance carrier as well. And so whenever there's more than one insurance carrier, then that means there are competitive rates that benefit the beneficiaries and the consumers.
And JT, I want to ask you, this is your second year with the grant money. How were your efforts last year, and how do you expect things to go this year in this awareness campaign?
We were very successful last year. That's why we were funded again this year. There were several other Urban League affiliates around the country that was funded last year, and several of them were not funded this year. Dr. Smith has done an outstanding job in getting the word out there. And of course, the National Urban League was very, very engaged in the passage of the Affordable Care Act. We had somewhat like a war room going on at that time, where we were totally engaged in that process. Health care, to me, is the bottom line when it comes to equity and empowering communities. We can talk about economic development, which is great, but if you don't have the health, good health, to participate in the thriving economy, you can't make it, in essence. And so we're just really fortunate that we do have the Affordable Care Act, and it has gained so much momentum now, and people see it as a very, very positive thing. We need to send a message to many South Carolinians, because when it comes to health inequities, South Carolina is one of the leading states in the country, particularly African American health status. Several years ago, the Columbia Urban League in the state of Black South Carolina pointed out the great inequities. As a result of that, South Carolina DHEC, health departments, started a focus on minority health, closing the health gap. So the Affordable Care Act allows people to not use the emergency room as their primary care medical services. And I think quite often there are too many people who are using emergency rooms around the state, and they think because they think the emergency room is their primary care physician because they don't have other options, and this is a great option for them.
It allows them to see a doctor for whatever their actual needs might be.
Yes.
As one of the challenges the enrollment period faced last year was under the current administration, funding for marketing and advertising was cut for the program, as well as the time period for enrollment was cut in half. You're dealing with that again this year. What impact, if any, has that had on the whole process?
Well, it definitely has a major impact, because a lot of times people like to wait until the last minute to get covered, and to know that there's a time limit is very important, so that way people can have the actual health care coverage that they need to ensure that their family is healthy. One of the things that we know is being able to afford health insurance, or the lack of health care, causes bankruptcies, causes financial strains. And so what we're doing here at the Columbia Urban League is funneling all those dollars toward advertisement marketing on several different mediums. We're across the airwaves on radio, we're on television. We also have actual enrollment events, whereas we're going into the community where people are to give them information about ACA and also be there and available to sign them up, so that way we can kind of mitigate some of those disparities.
And let's talk about that. You guys have an event coming up here in Orangeburg. I think we have the details to put on your screen here. It's happening at the Kingdom Life Ministries there in Orangeburg, 4 to 6 p.m. What's the date there?
It's going to be November 27th, Tuesday,
27th.
November 27th. And we do try to concentrate our efforts in the rural communities, because oftentimes they're the community that's uninformed or underinformed. And so we're partnering with the Tri-County ACA work group down in Orangeburg County to be able to offer those efforts. We're also doing some things up here in Richland County and Lexington County. So if there are any organizations that want to partner with us to be able to offer those types of enrollment events, we welcome that, because we do have insurance brokers available to sign people up. And we want people to understand that we now are on the cusp of 4 weeks in terms of getting enrolled. And also for those who have enrolled last year, they still need to re-enroll again this year, because there are other options. As I stated, there are other insurance carriers now. There are more plans that are more amenable to family situations. So definitely look at what's available.
Okay. And yeah, your needs could change from year to year. So it's good to take a second look every year it comes around. Yeah. Well, thank you guys both. Quick break this morning on awareness. More when we come back.
No one wants to be in a car or truck accident. They can lead to large medical bills, physical therapy, surgery, and lost wages. I'm Carl Solomon of the Solomon Law Group and the Legal Minute on WIS. If you've been hurt in an accident, give the Solomon Law Group a call. The best time to hire a lawyer is before you give a statement to an insurance company. Not getting help first makes it harder to get you proper compensation, and the consultation is free. Give us a call, 803-900-9000.
Have a car? A title? Let Title Max stuff your stocking with holiday cash you need. No matter if you've been naughty or nice, Title Max accepts all credit types. Go by one of our 1,200 locations, get the cash you need in as little as 30 minutes. Go to TitleMax.com to see how much cash you can get.
I got $1,000. $3,000. $10,000.
So this holiday, if you need cash, bring your title to Title Max, and you too will say,
I got my title back with Title Max.
Get your title back with Title Max.
This is an important message for anyone with Medicare. You may be eligible for an all-in-one Medicare plan that combines hospital, medical, and prescription drug coverage together with extra benefits that may include dental, vision, hearing aids, and much more. Some of these plans have a $0 monthly premium regardless of your income. That's right. For one low plan premium, or in some cases a $0 premium, you may be able to get coverage for your hospital visits, doctor appointments, prescription drugs, routine dental care, eyeglasses and contact lenses, hearing aids, and possibly more. Today may be the first time you've heard about this type of Medicare plan. The advisors at the Medicare.com helpline are licensed insurance agents who will explain more when you call. Call now to see if you qualify. Call the number on your screen now. Call now to see if you qualify for these benefits. You worked hard for your Medicare. Now is the time for your Medicare to work hard for you. Not affiliated with or acting on behalf of any government agency or program.
WIS-TV is looking for organizations that regularly distribute information about employment opportunities to job applicants or have job applicants to refer. If your organization would like to receive notifications of job vacancies at WIS-TV, please notify Stephanie Shealy, WIS-TV, 1111 Bull Street, Columbia, South Carolina, 29201, or email to sShealy@WISTV.com. WIS-TV is an equal opportunity employer and encourages minorities to apply.
Welcome back this morning. We're now joined by Joel Lurie of Lurie Life and Health, and you help people sign up for the Affordable Care Act, Joel. Just real quickly, tell us what are some of the things you see when people come to your office?
So, Leland, thanks for having me on, and it's great to be here with friends of mine, Dr. Smith and JT. What we see is still an incredible amount of interest in the Affordable Care Act. You know, when President Obama led this effort and Congress passed it in, 2009, his vision was that people could buy health care and have access to affordable health insurance so that they got sick, they wouldn't go into bankruptcy. Health care is the number one reason people go into bankruptcy. And people can argue the politics of this all day long.
what we've seen in the last 5 years is this historic drop in the uninsured rate. And we see that right here in South Carolina. We would see more of it if we expanded Medicaid, but we've still seen an historic drop in the uninsured rate. We see people coming in or on the telephone, because it can be done on the telephone, takes a few minutes, and many of them, for the first time of their life, are relieved to know that they can go see a doctor, they can get on have prescription drug benefits, even if they get hospitalized, and they don't walk out of there with the six-figure bill that will follow them around the rest of their life. So it's really, you know, my background is public service, and I was very interested in health care and helping people. And to see this happen in a business environment where people every day can get plans that meet their needs, meet their budget, I would argue that the Affordable Care Act, even in a state like ours, has been a tremendous success.
Yes. I think some people have an idea of what people who might need or enroll in health care through the ACA look like. But Macy, you shared with me, I just learned this a little while ago, you are actually a beneficiary of the ACA, and Joel is your agent that helped you get covered.
He did, and to me, you know, I've always worked with individuals who had the lack of health care coverage that would overuse the hospital and the emergency room as their primary care physician, a primary care practice. And to Joel's point, knowing that you have access to that information and that health care, it relieves a lot of anxiety and stress, which reduces your risk of developing comorbid conditions. And so in my situation as a beneficiary of the ACA, I'm able to pursue entrepreneurship at this point because, you know, for so many years I worked for the insurance. And so knowing that I can fulfill the American dream of owning my own business and make sure that my entire family is covered and has good, adequate insurance was absolutely a blessing. And so I urge everyone just to even come and get information about it to make good, informed decisions about adequate and appropriate health care coverage.
Yeah, there's a range of people that benefit or can benefit from the ACA. I want to bring you back in here, Joel. Every year it comes up the conversation about premiums and the subsidies and how the premiums are high, but the subsidies, you know, affect that and bring them down. Just kind of explain that, how the process works.
Thank you. And I'm glad you asked that question. The premiums are tied to assistance through the government, through the federal government, through the Affordable Care Act. So one's premium is tied to assistance that is tied to their income level. So if you think about it, it really makes sense. If you're earning more income, then you get less assistance because you need less assistance. If you're hovering at a lower income or slightly above the poverty level, there's a lot more assistance to help you so that you don't, you know, somebody's making, Leland, and we see this every day, $12,000, $14,000 a year, they can't afford $500 a month like somebody that might be making $60,000 a year. So it makes great sense. I want to also reiterate something that Dr. Smith said. It's critically important. If all you want to do is renew your plan, speak to a professional, the service is free, we don't charge anything, okay, the service is free, and update your application in healthcare.gov. Even if you want to just renew in the same plan, because remember, as you asked the question, that assistance is tied to your income. And if your income changes, we want to make sure you're reaping the maximum amount of assistance that you're eligible for. So it takes 5 minutes. Excuse me, I didn't mean to cut you off. It takes 5 minutes to do that.
Seems very simple. You have to go in and find out for yourself to see just how simple or not it is. But let's pull up some numbers here from South Carolina for that outline enrollment here in our state over the years. If you look at this data is from healthcare.gov. In 2015, we saw 210,000 people enrolled during the period. And if you look at these numbers, it kind of spikes in 2016 and then dips a little in 2017. And for last year, in 2018, insurance, people enrolling for insurance through the ACA kind of dropped significantly from 230 to 215. And that's here in South Carolina. Someone chime in here. Why do you think that is?
I'll take it. And first of all, it's only a 5% drop. Okay, so if you look at it, I think what you saw clearly going into 16 and 17, you had an election year. And then last year, all you heard out of Washington was repeal, replace, repeal, replace, repeal, replace. And I think a lot of people got confused. You brought up earlier, the law has changed this year. There's no longer a penalty, okay? So you may see some people move into what we call short-term health plans. We don't necessarily advise that because they're not comprehensive in nature. They don't have, drug benefits or the comprehensive benefits that a full comprehensive plan has. But all you saw coming out of Washington was repeal, replace, repeal, replace, repeal, replace. Now that the dust is settled, we expect the numbers to kind of level off. You may see another dip this year as the penalty goes away, but the number one reason people buy insurance is not because of the penalty. They buy insurance to prevent them going into bankruptcy or a financial arrears if in fact they have a catastrophic medical condition. We always say the cost of having insurance is far less than the cost of not having it.
Absolutely.
We're in our state. Go ahead, JT.
Yeah, I think important is just having access, I mean, some people don't even have access. They're not even thinking about the financial consequences for a certain segment of our population. Just having access. We deal with so many people who do not have adequate coverage. And so this is a great equalizer for them. That's why we have such a high percentage of diabetes, hypertension in South Carolina, among particularly the African American community. People deny themselves for adequate health care over the years. And when they get older in life, they really are so sick. It's hard to rebound. And so now we have a pathway for people to be healthy. And when you're healthy, you can be productive.
And I want to touch on that too real quick because I'm glad you mentioned it. We live in the stroke belt, okay? I mean, the Southeast has some of the highest rates of diabetes and hypertension. And one of the great things that plans offer, even if we don't get a chance, even the zero premium plans. So there are zero premium plans that a couple of 100,000 South Carolinians could qualify for based on their income. And even those plans provide a generic drug benefit. So, JT, to your point, if we can just get people taking their maintenance medications for blood pressure and diabetes, the outcomes will continue to get better in the state.
Here in our state, we just had an election as well, a midterm election. Governor McMaster won re-election there. That likely means no Medicaid expansion under the law here in South Carolina. And on the federal level, post-midterm elections, Republicans have pretty much, it seems, abandoned the repeal and replace fight and argument. So those two things together, here at home and nationally, what does that mean for South Carolinians in this law?
Refer you, Joe.
Yeah, we'll look at you, Joe.
Well, I can tell you, I'm meeting with a group next week. I was responding to an email prior that is going to come back to the State House and continue to talk about Medicaid expansion. It was one of the things that I was very passionate about. Our dear friend, late Senator Pinckney, was very passionate about it. I remember talking to him the week that the tragedy occurred in Charleston about why we needed this in South Carolina. So we're going to continue to push for it, and maybe we can push for it in terms of comprehensive Medicaid reform. At the end of the day, you've got about 150,000 people that fall under the income levels. They don't qualify for a subsidy. Those folks are still going to need access to health care. So would we rather give them preventive care, or would we rather them go into the emergency room where the cost is 10 times more? So don't know about Washington, but I can tell you we're going to continue to talk about it. We may be the 50th state to implement expansion, but we're not going to rest until something positive happens so that we can bring more people into preventive care in the state and have better outcomes.
All right, a quick break here. Right back on Awareness.
If you're stuck with slow DSL or can't get cable, we've got great news. Super fast internet from Viasat is here. With Viasat Internet, there's no more choppy video streaming, and you can connect multiple devices with total confidence. Try that with DSL or cell phone internet. Upgrade now to much faster internet. In fact, Viasat is 3 times faster than typical DSL. And with unlimited data and reliable Wi-Fi, you'll never run out of things to do online. Call Viasat today at 1-888-383-0635 and get the home or business internet you've been waiting for. Get Viasat now and we'll guarantee your price for 2 full years. And if you call now, our plans start as low as $50 per month. Plus, you get free standard installation that's fast and easy. Go to getviasat.com or call 1-888-383-0635 to sign up today or visit your local Viasat retailer. Viasat, fast for all, is here.
He's the family chef, but most days, getting a good meal on the table is a struggle. There's homework, practices, emails. Sometimes keeping up with mealtime means using the chef's go-to sidekick, delicious Bob Evans mashed potatoes, made with real milk, butter, and potatoes. Bob Evans sides are ready in 6 minutes. They're wholesome, delicious, and the perfect complement to any meal. And once you try them, it'll be love at first bite. Get Bob Evans in the grocery store today.
Bob Evans down on the farm.
I'm attorney Kiminastapulo. I've been practicing law in South Carolina for over 30 years. If you've been injured in a car wreck, call our office now.
Don't scream, call Akeem.
Dial all twos now.
To get your attorney, dial all twos.
Chief Meteorologist Deminis Brown, weeknights on WIS.
All right, welcome back this morning. I'm going to continue this conversation about the open enrollment period for the Affordable Care Act this year. You were just saying, Dr. Smith, about how the ACA and preventative care can really go hand in hand as we have an aging population here in our state.
Absolutely. This is so important because we want to age on purpose and age healthily. So basically what decisions you make early on absolutely can set the stage for how you age. And so when we think about being preventive, as Joel stated, it's less expensive to be preventive than reactive. And so education and information is most important. When we look at our aging state, we know that our individuals are aging with multiple chronic illnesses, multiple morbidity, but less than 1% of the healthcare dollars is going towards education and information and prevention, and that is problematic.
And as a gerontologist, this is something you see quite often.
I do. Yeah. I do. And so when we think about family caregivers who are caring for an older person and they're between the ages of 49 and 55 and 64 years of age, they may need access to ACA information as well and access to information on how to prevent stressors that can lead to heart disease and diabetes and things of that nature.
Now, there are, of course, Americans of all backgrounds enrolling in insurance through the Affordable Care Act. Talk more about how this really impacts the African-American community. From what you know, do you see rates of enrollment at a decent rate, or would you like to see more of that?
Certainly we want to see an increase in the percentage of African-American people enrolling because, adversely, African-American people have some of the highest health risks in the state. And I think we got to reframe this whole health care agenda. To me, it's an economic development engine. You cannot have a healthy, robust economy without a healthy workforce. And so somehow people want to relegate health care to a social agenda. We provide incentives for companies to come in our state to do business, and we have to make sure that we have a readily workforce. There's a lot of discussion now about a workforce not prepared. And so the Affordable Care Act can really assist a lot of people. We got to get the word out. Our elected authorities got to understand that this is not a partisan issue. This is a humanitarian issue. And we got to be forthright in advocating to level the playing field for all South Carolinians. Health care. Even access to health care. Affordable health care. Let's say
affordable health care.
even with the help and the subsidies and what's available, for some people, though, in my work as a reporter, the Affordable Health Care or the Affordable Care Act is not appropriately named. They say it's still not affordable. How do you reach those people and help them still understand what is possible for them?
Sure. So remember, the Affordable Care Act was designed to help people, Leland, that didn't have access to group insurance. So, you know, if you have group insurance, you don't qualify for a subsidy through the Affordable Care Act. I can tell you, when you go back and look at the history of premiums now, and I'm going to give our Blue Cross Blue Shield in this state a lot of credit, okay? When a lot of states were going up and down and pulling out of the market, they were a stable force. This year, the premium increase is so modest. And to your point about prevention, they even reward consumers with a card to get a flu shot, to get an annual wellness visit. I mean, they are very much in touch with the health care needs of South Carolina. And I really appreciate that because we've been very fortunate. Some states have had all the carriers pull out. So back to your point, though, remember what it was designed for. It was designed for people that don't have access to group insurance. So our job as a team, and we've had a great team of advocates, Palmetto Project, the Hospital Association, the Urban League, of course, my friend Dr. Smith. There's just such a great team that's really helped get the word out. And the numbers you showed earlier, we have experienced a pretty level enrollment rate in South Carolina, unlike other states, and we're proud of that.
What's the conversion rate? You guys are second year again with the Urban League getting this money to educate and make the public aware of the open enrollment period. Of those people that come to see you at your various events and information sessions, how many would you estimate actually go on to enroll in insurance through the ACA?
From what we did last year, approximately about 20% of the individuals who came in, number one, to get information, they were actually signed up in a plan. We had quite a few people come in who had Medicare. They weren't really sure if it was the same thing, if it was better, if they could get it. So a lot of time we spent educating individuals. So I would say about 20% of those who attend the events that we have in the community are signed up for ACA.
Pretty good. Hope to see more.
More of that.
I'm sure you do.
Yes.
And thank you all for being here today.
Thank you,
Leland.
If you want to reach out to the Columbia Urban League or Joel Laurie at his practice, Joel Laurie Life and Health, you can do so right here at these phone numbers on your screen, 803-799-8150, or you can reach Mr. Laurie at 803-256-2067. We'll be right back.
Attention Medicare beneficiaries. If you have or are eligible for Medicaid, please listen closely. You may be eligible for a Medicare Advantage plan from WellCare Health Plans with zero or low plan premium. Call 1-866-907-5952 now. That's 1-866-907-5952. Representatives will provide detailed information and help see if you qualify. WellCare provides access to a large network of local and regional doctors and hospitals. Plus, some plans may include benefits for dental, vision, hearing, Part D prescription drugs, and more. WellCare is contracted with Medicare to provide plans that may be right for you. Call 1-866-907-5952 now. That's 1-866-907-5952.
Attention Medicare beneficiaries. The Center for Medicare Services has officially authorized new benefits Medicare Advantage plans may include. Plans may now include private home aids and rides to medical appointments. Most plans also include dental, vision, hearing, and prescription drug coverage. To get the benefits you deserve, call the Medicare Coverage Helpline now.
Hi, I'm Joe Namath. I called the Medicare Coverage Helpline, and they instantly advised me that I wasn't getting all the benefits I deserved. They explained I could get a plan that includes dental and prescription coverage, as well as the new coverage for private home aids and rides to medical appointments. If you want to find out what you deserve, call the number on your screen now. It's free. You'll be happy you called, I guarantee it.
Call to see if you can save money and get more benefits now. Don't delay. Call now. It's free. Call 1-800-205-9085. That's 1-800-205-9085 now.
Welcome back this morning. I want to say a quick thank you once again to all my guests, Dr. Macy Smith, JT McLaughlin, and Joel Laurie. Again, if you want to attend that event with the Columbia Urban League, November 27th in Orangeburg at Kingdom Life Ministries, 4 to 8 p.m. that night. More info at 803-799-8150. And if you want to contact the Urban League or Mr. Laurie, you can do that here with the information on your screen. And that's our show on this Sunday morning. Have a great rest of your day.